So, please.
Hello, good afternoon. My name is Dr. Hamza and I am your treating doctor at Suburban Clinic. Can you please confirm your name and age of the child?
Yes, sure, doctor. His name is John, and he's 10-month old.
Okay, thank you. Okay, okay, how can I help you?
Doctor, actually, I'm very much concerned about my son. He's becoming, very weak since he had this diarrhea for last 24 hours. I mean, he had about 8 to 10 episodes of diarrhea and he had vomited twice as well. And now doctors are telling me that, I can take my son back home, and I'm quite concerned, and that is the reason I'm here.
Oh, I'm so sorry to hear that. It must be very distressing for you. Okay, can you tell me a little bit more about your child's symptoms? Like, is he passing urine?
Yes, doctor. He actually has a fever and he is coughing, but he is urinating regularly.
Okay. Okay, based upon the symptoms and examination, it shows that your child is having gastroenteritis, but it is a type of bowel infection, as you already described, and consists of the features like vomiting and diarrhea. But let me reassure you that your child is not in a serious condition and is stable now. Therefore, the doctor advised you to go to home, and there is no need of hospitalization admission.
Okay, doctor, but I'm very much worried. I'm panicking at the moment. And if you can please put my son here for a few more days, that would be really good. I mean,
As I have already told you that there is no need of admission, and I will prescribe you gastrolite which will help your child to recover and help and in a better position soon.
okay, doctor.
Am, am I clear so far?
Yes, doctor. And what about feeding? I mean, as you can see that he's having diarrhea at the moment. So what would I feed?
Yes, you should, as far as breastfeeding is concerned, you should continue it and try to be more frequent. Though the child may refuse at first, but he will uh, adopt to it and will continue feeding.
Okay, doctor.
Would you like to ask any other questions?
No, doctor, it's clear.
Okay, this is my card, and if you have any problem, you can contact me anytime.
Okay. Okay, Dr. Hamza. See, the good thing is that you are improving. I hope you can also see that improvement in you. The very first card, and now it's getting better. Okay. The good thing was that you were addressing the concerns, you were listening to the person, you were replying accordingly, and you were completing the task. A bit that I would like to add over here, there was a lack of engagement and empathy. Okay, when I said that, what would I do? What should I feed? So you can just see when there is someone asking a valid question, acknowledge that. Okay, say that's okay, Mrs. Smith. That's actually a really good question. I would appreciate that, and let me explain that. What we can do is we can continue breastfeeding, but do it rest the way you have said. Rest of the things are fine. There's no problem. Okay, and at the end, is that clear? And don't take pause in between. In between ending your task and saying, is it clear? Okay, because if you'll take a pause, eventually they as I mentioned, they are going to record it, right? So the recording is going to go there in the center or OET official, and they're going to check you according to that. So there should be no pause. Just be very fluent at the end of the task. Okay, so you can just complete the task and right away. Is that clear? Okay, so don't stop and then wait and then say, is it clear? Because if you'll pause, then there is no need to even say that is it clear after that, because eventually the person will speak, because there is going to be an awkward silence for a few seconds or maybe a nanoseconds. Okay, so these are some things that we have to improve. Rest of the things are fine, going well. Fluency is fine, no problem. We have some more days, and we inshallah will improve with the pass as the time passes. Okay.